63-year-old José Roberto Inácio spent much of his life ferrying the sick to a hospital in the quiet Brazilian town of Piratininga. Now, 1 week after entering that same hospital with COVID-19, the retired ambulance driver was buried in a cemetery just 2 blocks away. His son looked on as 4 men in hazmat suits carted his coffin to his final resting place and sealed his tomb.
All his life, he worked to save people, but in the hour that he needed help, there was nothing for him.
Inácio's son, Roberto, told Reuters that his father died waiting for intensive care. He was just one on a long list for an ICU bed, but doctors told the family there were 70 people already in line. Bauru, the nearest major town, has 50 intensive care beds, and all were full.
You watch a person dying, and you can't do anything about it.
Across the country, Brazil's health system is buckling, with over 6,000 people waiting for an ICU bed, according to government data. Despite the crisis, President Jair Bolsonaro continues to ridicule stay-at-home measures. He told Brazilians to, quote, stop whining about the virus death toll, now over 300,000, the world's second highest behind the United States. On the front line, doctors in Brazil are exhausted, understaffed, and under-resourced against the relentless tide of infections.
People have been talking for months about the risk of the public health system collapsing. Sadly, that moment has come.
Dr. Fred Nicasio said the hospital he works at had 28 coronavirus deaths from March 15th to March 23rd, which he said was a lot for his hospital, and that all the patients died waiting to be admitted to an ICU.